experiencing some trouble with twitching in both the hands and feet, as well as a difficulty standing up and then walking. I boxed professionally for about 10 years and ran to get in shape. These days I can rarely exercise without feeling pain. I've been told by friends that I shuffle my feet occasionally and that I'm walking more slowly.
Yes, I see from my record that you've been suffering from this for a while. Is there any non-related physical problems?
The only one that comes to mind is trouble sleeping.
And has this been occurring recently or for a while now?
Well, I did have some trouble when I boxed, but it's becoming more and more difficult to fall asleep nowadays.
Tell me more about these shakings in the hands. How long have these tremors been going on in your hands?
Well, I first noticed the shakes around a year ago. And I didn't think much of them at the time, but as the year went on, they've gradually gotten worse. Some days are worse than others, but for the most part, the shaking is present.
Can you please hold out your hands so I can see these tremors? That's good. Well, Mr. Wilson, I hate to be the bearer of bad news, but these are all early symptoms of Parkinson's disease.
What?
Now, of course, there's other less common disorders that would have these symptoms, so we don't know if you have Parkinson's disease for sure. We can reassure this by having neurological exams to further determine your prognosis, as also checking your family's medical history. So far, scientists have discovered that there's 5 genes associated with Parkinson's. We don't know exactly if they cause it or not. Would you know of any family history with this disorder at all?
Not that I can remember. How did this happen to me? Did I catch it from someone?
No. Parkinson's isn't something you catch. It results from a chemical imbalance in the small area deep within the middle of the brain called substantia nigra. That controls muscle movements, coordination, and balance. Substantia nigra is responsible for producing the dopamine neurotransmitters that delivers a signal from the brain to your body, helping with movement. As associated with your symptoms, this is obviously why it's associated with substantia nigra. If these cells die off for whatever reason, then the dopamine is not delivered to the places that make movement possible.
Why did this happen to me?
Well, Parkinson's affects about 1.5 million Americans. At this age, it's more likely for you to develop Parkinson's. Most men and women who get the disease first show signs of it between the age of 50 through 70.
Well, I am 51 years old as of last week. Well, what can I do? I don't think there's a cure for this, but are there any medicines that can help? Because I'm willing to do anything if it means slowing down this disease.
Well, first of all, we don't know if you even have the disease for sure. But we can give you some medicines that usually relieve the symptoms of a Parkinson's patient. And if these symptoms are alleviated, then we can be pretty sure that you have Parkinson's.
Okay. Well, I'd like to be able to talk to someone about this and how I can handle it. Is there anyone or any group that can help handle these cases?
Well, there's focus groups all around our community, and we also have counseling in the offices if you like to take off some of that. There's also national organizations that support you through your struggles. Some of these organizations are